Welcome. Hi, it's Dr. Tony Joseph, and we're here to talk with Dr. Samuel Gidding of Nemours Foundation about antecedents of heart failure and some of the work that's being done across the country in the CARDIA study. Welcome, Dr. Gidding.
Hi, Dr. Joseph.
Tell us a little bit about the National Heart and Lung Blood Institute's CARDIA study.
Well, CARDIA is a longitudinal study that was begun over 25 years ago, and the goal was to look at coronary risk development in young adults. As the study has evolved and the obesity epidemic has evolved concurrently with the study, there's also been a strong interest in heart failure and heart function, as well as some of these heart failure endpoints have started to emerge in the cohort. The cohort was 18 to 30 years at initial recruitment and divided three ways. It was half African American, half Caucasian, half with a above high school education, and half below, and half men and women. So there's about 8 equal-sized subgroups in the study, and since they started at 18 to 30 and the last exam was year 25, the last examination data is at ages 43 to 55. I'm going to comment here on the echo data, which was collected mostly in years 5 and year 25. There was a brief exam in year 10 in about a quarter of the participants.
You know, as I look at some of the published ideas that have come out of this and some of the hard endpoints, you've got some serious p-values and confidence intervals. Just walk us through a few of these.
Okay. Yeah, so the introduction to all this is a study by Kristen Bibbins-Domingo, which was published in the New England Journal in 2000. And this is really the first CARDIA endpoint study. And it showed that heart failure actually was one of the initial presentations rather than acute coronary disease, and it was almost exclusively in African Americans. So that as we followed these individuals, and the retention rate has been extremely high with almost 90% responding to annual phone calls and about 70-some% being seen at each exam, we began collecting the outcomes data, the cardiac data. If you can go on to the next slide, what you can see is that 27 individuals developed heart failure, and all these were African American except for one white woman, and about 1% of African Americans starting at age 18 to 30 developed heart failure within the next 20 years or so. And the things that seem to be common amongst these people were overweight, blood pressure, diabetes, low HDL, chronic kidney disease, and from an echo standpoint, an ejection fraction between 40 and 60%. And in CARDIA overall, as I mentioned, heart failure was twice as likely to be the primary incident event in these individuals. Next.
I think this just gives us great insight into where we need to focus our efforts, both in the clinical, as doctors, nurses, etc., but also within our community health initiatives.
Exactly. And then my particular interest is left ventricular mass. This is a summary slide from a paper we recently published in JACC Cardiovascular Imaging. And what this shows summarizes all the studies that have been done looking at left ventricular mass as a predictor of future, or actually this is just looking at magnetic resonance predicting future cardiac events. And you can see that elevated left ventricular mass, and this is true also for echocardiography, predicts cardiovascular events quite well. Now, in the original Bibbins-Domingo study, that didn't turn out to be true, but there's a very low number of events. If we go to the next slide, what we can see, going back to year 5 in CARDIA, that if you look at people who have no cardiovascular risk factors, that is, people who are not obese, who have normal blood pressure, who don't smoke, who don't have diabetes, and who are relatively physically fit, their left ventricular mass is about 10% lower both in men and women than the other 85 to 90% of the cohort that has at least one of those adverse traits. So we know that being healthy keeps your heart in very good shape, and that as you move away from optimal risk, that left ventricular mass increases and some of these other adverse effects occur. So in the webinar we'll discuss is actually some newer data from the year 25 echoes and how that interacts with both with risk factors, cardiac function, and also some data on outcomes.
Excellent. So anyone interested is welcome to join us, and if you miss the date, these are recorded webinars. Contact us. We'll give you a username and password that is complimentary. And Dr. Gidding, thank you so much for joining me today for this discussion, and I look forward to your formal presentation tomorrow. Thank you.
Great.